Hey everybody, it's Kurt here with Amy. Amy is our project manager for Haiti and Guatemala. This video, I've asked Amy to jump on with me and just give us all a quick update on where we are with our COVID response in Guatemala. So, hi Amy.
Hi Kurt.
Good to see you. So give us an update. Start with kind of Guatemala at a high level, and then we'll work down to what we're doing and what's happening in our communities.
Okay. Well, I'll say Guatemala is a little bit unique to Kenya and Haiti in that there's quite a few more restrictions still in place there. And from my conversations with the staff there, you know, they feel kind of probably where we felt several months ago in the whole pandemic thing. They feel like that they haven't really reached their peak. So it's kind of hard to have conversations sometimes about the next step there, the next phase. But yeah, so we're just working through that. The new thing that has happened within the last week is the national government has kind of put in place this plan to look at reopening the country at various levels moving forward. Every 2 weeks, they will issue an alert based on the municipality that you live in. And for the next 2 weeks, you will live under those restrictions related to that alert. And that can change every 2 weeks. It's based on how many new cases are reported the previous 2 weeks. So currently, all of our communities in Guatemala are under what they're labeling an orange alert, which is not red, the most restrictive, but green would be getting back to normal kind of situation. So they still have curfews. There's limited public transportation. Some businesses are open, but they're still quite a bit restricted. The unusual thing about, or not unusual thing, but the one thing about this is that the local municipalities aren't really following the guidance of the national government. The local mayors in some instances have come together and said, well, we see cases rising in our area at a higher level than we think that you appreciate, and so we're going to keep our restrictions in place. So it's
they're doing an even greater restriction. So while the national government says they're an orange, they may, in their local municipality, be a red.
Right. In their minds, they're a red. And so what that means is they're continuing to maybe block entrances of travel in and out of their community, and just, you know, much stricter curfews within the community. That's kind of, yeah, like we said, it's regardless of what the national government is saying. They're saying, this is what we want to do here.
So it's a green, yellow, orange, red type of a rating system?
Yes.
Okay. And the curfews, tell us a little bit about those curfews. What, they're still on the weekends? Are they, you said they might be stronger than that? I mean, what are the curfews?
Yeah, so if you're in a red, they may have a complete lockdown on a weekend or whatever. Our current curfews in the orange alert with our communities is, I think it's 9 p.m. to 4 a.m. Is what the government says the curfew should be.
Every day.
Mm-hmm. Yeah.
Oh, okay.
But the local mayor may say, no, we want a 6 p.m. to 5 a.m. curfew or something like that. So you kind of have to be in the actual city to understand exactly what the restrictions are.
Okay, so we have kind of exited, if you will, or segued out of kind of this relief, helping the most vulnerable people in our communities with food and some hygiene, sanitation issues and so forth. But what are we able to do? What's our plan? Where are we headed these days?
Yeah, so the plan, what we're able to do right now is very restricted. But the plan is, as things do open up in an appropriate way, we're gonna help our communities kind of get back to a restart in the economic development area, schools reopening and churches reopening, and we'll continue to kind of look at some, very vulnerable families that would still struggle even in the reopening or whatever, and try to meet some needs there. But the big emphasis is going to just be helping people get back on their feet again.
What does that look like economically? I know it's different in Guatemala than it is in Haiti or in Kenya.
Yeah, definitely. I mean, we'll be defining that plan, I think, in a more detailed way as we get closer to that. But we're looking at ways just to get people back to work, get the farmers, back in their normal operating and just being able to come back from this. We'll be looking at doing some training around coffee, maybe some other types of farming in that area, and then also just helping maybe get them back into some business opportunities that might be in front of them that you just can't do when everything's so restricted.
Yeah. And what about schools? What's the word on the schools?
This is a big mystery. Like, the government has not mentioned schools at all. They're not addressing the situation at all. So from a timing perspective, we're not sure when we can start to plan to help our schools. But when we do have that information, we're going to be ready to help them reopen, safely and as quickly as possible. And right now, we think that looks like on getting them cleaning supplies, getting them a thermometer to monitor the health of the students and the teachers, getting masks where needed, if they need them in the classroom, and also potentially a wash station, just so that they can maintain some safety protocols while they're on the school grounds.
But there's right now no visibility to when schools are going to open.
Yeah, it's really a big mystery around education there.
Okay, and then lastly, you said churches. So what are we doing there?
Yeah, so along with this alert system, churches are, according to the national government, allowed to meet for like 30 minutes with social distancing in place. From what I'm hearing is not many of the churches are opening yet in the community. But we are starting to have conversations with them about what their plans are around that. And we'll be helping much in the same way that we're helping the schools, masks where needed, cleaning supplies, a wash station if they need something like that, and a thermometer.
Okay, great. Well, thanks for that update. So, again, just try to land this plane for us. What's, it clearly is different in Guatemala than it is currently in Haiti or Kenya. I mean, they seem to be Haiti on the front end of that curve, which is surprising on reopening, but Guatemala is on the tail end of that curve. So
for sure.
Give us Amy's perspective, and then we'll try to wrap this up.
Well, I mean, we have a lot of work in front of us on reopening this. From my perspective, and here in our U.S. office, we're excited to when that starts happening to get that going. And I think I feel a sense of urgency, specifically to help as quickly as possible get people back on their feet and get our communities back up and operating normally. The countries right now, our staff is super grateful. Our communities are super grateful for how we've helped during the relief period, and our plans moving forward on how to help them get back on their feet. And we're just going to work hard to make it happen and do the best we can when things do open up. And as always, there's just such appreciation for the prayers and the support that they feel coming from the U.S. And that's just a huge lift.
Yeah. Well, send their staff our best from everybody here, and there's only a few of them down there, and they're they're running in every different direction. So thanks for that update, Amy. We're grateful for that. And we'll probably get back together here in the next few weeks or a month or so as things start evolving in Guatemala. Maybe we'll have a little bit more visibility to when things are going to open up. So thanks a lot. Appreciate it.